Alright, good morning. I'm going to do an Ezpap. So first thing I'm going to do is check the patient's chart, and then I will enter the room, knock on the door, introduce myself, and then I'll check the patient's ID band. I'll wash my hands, and then I'll assess the patient, make sure I'll check their vital signs and listen to their lungs before I begin. Alright, so here I have an Ezpap. So you have a little device here. And so you can have a mouthpiece on here, and you can also do a nebulizer treatment on with it as well. Just with a nebulizer treatment, there'll be another piece on the end. It'll be a T-piece with a little medicine cup at the bottom. And every Ezpap thing comes with a disposable manometer just to measure to see how good their flow is. And so what you would do is remove this. Here, it's a little cap. You move that off, and then you take this white in and you'll place it there. There's two little valves. So this is where you'd place it. And then where you want it to be set at, you take a little rubber band that it's on, then you'd move it to where you'd like them to be at. And then when you have them inhale and everything, it will raise up. And then that way you can see where they're at, and if they're not quite there, then you can get them to where they need to be. So you're going to connect this. The Ezpap connects to an oxygen source. So I'm going to connect the oxygen piece to it. Make sure it's tightly on there. Make sure there's not going to be any air leaks or anything coming out. So what I'm going to do is connect it here to a quick connect Thorpe tube here. I'm going to turn it on at least 5 liters per minute. And so I'm going to instruct the patient to take a nice deep breath in and exhale. So this is going to help them kind of get their flow. It's going to open up their lungs and everything, and just tell them it's just going to help them clear out anything that can be in their lungs. It'll help them. So tell them not to obstruct the in. As you can hear, it's going to cause a noise, and it's not going to get the airflow that it needs with the oxygen and them to get the flow. And so when you are doing this, you'll have them do that, and you'll have them hold it upright like this. Have you take a nice deep breath in and out, and you'll give them a break. You don't want them to be too overwhelmed, especially with along with the oxygen. The flow can probably it can dry them up and bother them. So once we get done with this, and you're done giving them the treatment, you'll have them do it a couple times, and give them a break, always in between, so they don't get lightheaded or anything like that. You'll shut this off when you're done. Remove it from the oxygen source. So with this is a disposable manometer, so you dispose of that. So when you're done with that, you can move it, but always place the cap back on to your Ezpap here, and then you would remove the oxygen cord here. You would wrap it up, and you set it aside to where you can use it again, because this can be used again with your Ezpap. So when you're done, you'll wrap this up, set it in a safe place along with your device. And with this, you want to instruct them not to place it in water so you don't ruin anything or don't cause any problems with it. You can take the mouthpiece off and dry it. You can wash it with sterile water, the mouthpiece, and set it. So this you just set off to the side when you're done with it. And then every time you do a treatment, you always have the patient do a nice deep cough after every treatment. And then if they cough up anything, you always need a chart to make sure you chart down if they have any thick secretions, like if it has a distinct odor or anything like that. And so, and then if you need a sample, you can take it in a sample cup to the lab. When I'm all finished, I'll wash my hands after everything is put off to the side in an appropriate area to keep it sanitary. I will reassess the patient, listen to the patient's lungs to see if it is helping them, and then I'll also chart down the vital signs of after the treatment, if it's starting to help improve their vital signs, anything like that. And then I would go out to the and chart on the patient's chart, and then I would let the doctor know that I did an Ezpap with.